Menia Koukougianni, that is managing partner of non-profit organization Karkinaki, co-founder of this organization, and is going to speak about challenges and opportunities in the patient's pathway.
Hello, everyone. Thank you for
you have 20 minutes.
Thank you for the invitation. Okay. Thank you for the invitation, and I'm really sorry that I can't be with you. It's a pleasure for attending your conference, and also it's a pleasure for the patient community to give us this opportunity to talk about all the issues that are related to health. Should I share my presentation?
Yes, please.
Okay. So I'm here with you. I think it's okay, right? I'm here with you representing.
You should.
Representing the rare disease Greece. It's a Greek association for rare disease. And as you have already
see your presentation in the presentation mode, can you please do it again from the beginning? So please try to share the entire screen. I think it's going to be better.
Now?
Now it's okay. Thanks.
Okay, thank you very much. So as I said, I'm representing the Rare Disease Greece. It is the Hellenic Federation for Rare Diseases, and I'm also a patient advocate for childhood and adolescent cancer. I was a caregiver when my daughter was diagnosed with cancer at the age of 3 years old, and now she's a young survivor. Today we're going to present the challenges and opportunities in the patient's pathway to access, because the most important of all is the access that the patients are having to innovative therapies. I'm really sorry, but I cannot proceed with my presentation. Can anyone please help me?
Please try to click on it or press enter or the space button.
Okay, I found it. Thank you. As I don't want to take any more time with these technical problems, and I'm sure that you have already mentioned some data for Greece about rare diseases. The most important for us is that the rare diseases generally are affected in a high rates kids, and this is something that we are advocating for. Some short data for the Rare Disease Greece organization. We consist of 30 regular members, including associations, societies, and NGOs representing patients with rare disease across Greece. It is the largest representative body for rare disease patients in Greece and an institutional partner of all public and non-public entities. We participate in committees and working groups such as the Rare Disease Committee, the Registry Working Group, the Pharmaceutical Expenditure Committee of the Ministry of Health, and others. And we are the official representative body of Greece abroad, a member of European Organization for Rare Diseases. These are the members of the Rare Disease Greece. I'm sorry, and these are some of the European projects that we are participating. I don't want to waste time explaining all of this. International projects that our organization is also a very active member, and these are some project portfolio that we are running in Greece with different stakeholders. This is a project that we are very, very proud of, a PQU research and support that Probably by the end of the year, we're going to present some very important data for this project. The access for prevention to treatment. This is the most important issue for patients and their families. First of all, we have prevention and we need some national plans. Secondly, we need to have early and accurate diagnosis. Thirdly, we need to have access to optimal care and innovative treatments. And we also need to have access to social care and research. The need for a national action plan starts from the prevention. We need to develop screening policies. We need to have a dedicated R&D research programs and governance of rare disease research fund. We need to have timely diagnosis. This is very important. For example, in childhood cancer, we need to have early diagnosis as we don't have a prevention. We need to have care to therapy, and we also need to have research and education. These are factors that you have already talked about in your conference, but it's very important for us to advocate for all these important plans we need to have, not only in Greece, but also in Europe. I'm going just to present, just to have an idea of the health budget implications in Greece. And you can see, for example, that the total cost of the DMD over a 2-year time frame is 0.8 of the total health expenditure in Greece. And for example, for the SMA patients, the total cost is 1.2% of the total health expenditure in Greece. So it's very important to start talking about what we can do and what we can all do to change all this number. What are the barriers the patients face when we're talking to innovative therapy? First of all, it's the lack of information. Secondly, it's the lack of communication and the lack of communication between the healthcare providers. The barrier language, this is very important. In most of the cases, all the procedure is time consuming, and we also lack of support. What the patient needs, and this is why I'm here with you today. We need access to innovative treatment. This is for sure. But we also need better communication and collaboration with all the medical and the research team. We need facilitation on the procedure. And we also need to have guidelines, what we're going to do, what is going to happen, how I'm going to access the innovative treatment. And especially in cases that I have to travel abroad for accessing the innovative treatment, the procedure and the guidelines for the procedure have to be more easy for the patient and the family to understand. And also, what about the follow-up care? Okay, I can travel to Italy for having having a treatment, but what is going to happen to me when I come back to Greece, for example? These are also some data that I can share with you for how many patients from Greece traveled abroad for this therapy. For example, for proton therapy, how many Greek patients traveled to France, to Germany, to different European countries, for the carbon ion therapy, for the hadron ion therapy, and for the heavy ion therapy. Probably you already know these numbers, but for me, these numbers also show us the inequalities that we have also to fight in Europe. But how we can change this situation? We need to train healthcare professionals and providers. That doesn't mean that we have an innovative therapy and all the healthcare providers and all the healthcare professionals, do they have a real understanding of what is going on and how they can help the patients? We need also to train patients, experts, and advocates for communicating and collaborating with the patients and the families for accessing an innovative therapy. We need to have guidelines for access. I'm sorry that I'm talking for guidelines, but you can all realize and understand how important are the guidelines. We need to eliminate paperwork because, believe me, it's very difficult for a patient and a family, or even for a patient organization sometimes, to catch up all this paperwork that is needed. We need to facilitate cross-border health. We know that we have a European guideline, but we also need national laws for cross-border health. We need to have guidelines for follow-up, and we also need to establish national expert centers in order to make the access to innovative therapies more equal for all patients. What is the patient's organization's role? Representation and advocacy. Patients' organizations will play a central role as we represent the rights and the needs of the patients. We actively participate in shaping policies and we promote the improvement of healthcare services. Awareness and education. Through organizations, we can inform patients about the opportunities science and research provide, and we encourage them to seek specialized care. We participate in decision-making. We actively participate in working groups and health committees, contributing to the formation of strategies for better integration of networks into national healthcare system. And this is also a proof for why do we need to be trained and how we can share the messages, the research outcomes with the patient community generally. We promote the participation in research. The majority of patients' organizations and the expert patient advocates, we are in favor of research because as patients, we need to live. We liaison with the pharmaceutical industry and regulatory authorities because we have to maintain the contact with pharmaceutical companies and regulatory authorities to express our views and concerns and to pursue improvements in research and drug development. We cite support and data collection. We maintain connections with clinical sites, conducted trials, patients, and often we ensure the collection and access to high-value data such as PROMs, patient reference data, patient experience data, and many others. And this is a case to follow and share in Greece. As you already know, this is the hospital of Papageorgiou in Thessaloniki. And for rare disease Greece and for other patients' organizations, this is a best case we are sharing with our communities about how can we all have access to innovative therapies, because Papageorgiou Hospital and their team has managed to do some of the things that as a patient community we need. For example, for the hadron therapy, they trained their healthcare providers and specialists. They also trained the patients' advocates. They are collaborating with other expert centers, and they facilitate all the paperwork and all the procedure a patient and the family needs for having access to this innovative therapy. So for us, this is a case to follow and share, and we also propose to all of you to do the same. So thank you very much. I don't want to take any more time with slides, and if we have some minutes, it would be a pleasure to have an open discussion about the patient's role and what we can really do to facilitate all this procedure. Thank you.
Thank you. Comments, Jota, please.
Thank you very much for participating and for your presentation summarizing all these issues. And I'm really happy to have you on the other end of the, let's say, families and organizations Yes, I would like to have some comments thanks to the work that Maria Bigaki from Papageorgiou did, and actually even technical terms that Elpida herself helped. We were able to start this process that is within the HITRI Plus transnational access program. And I have to say that we had enormous difficulties. Let's say, even collecting the patient data, I mean, there were CDs with MRIs and PET in different towns, different laboratories. The patients they were not aware that they have to keep our data. I mean, literally, we have sent the repeater to another town to collect physically the CD. And while we were trying to help with all these things, there are really difficulties of patients of, for example, Albanian origin, that they did not even speak Greek, let alone English, that we had to handle. So you can really help us there, because to my horror, one of the patients told me that they had finally to go to an agency in Athens that they had to pay in order to help them to collect all these things. And to top it all, we had to handle data privacy issues and things like that, while we had all kinds of papers for patients to sign, which they don't even care. I mean, for them, it's like, don't bother me with signing this paper, no? So you can help us in this kind of, at least from the patient point of view, to get organized with this kind of paperwork. Now the rest I will leave to Maria, because she really did a lot of work on contacting the OP and providing all the details to the patients, what kind of paperwork they have to provide. Actually, she helped us also to find English translation, because it is not any English, no? It has to be a special terminology to translate all the documents, etc., etc., etc.
Maria.
Dear Mrs. Koukougianni, thank you very much for your participation in this session. It's really important to be with us, to collaborate, and to reach all the patients and all the needs that you have in order to have a better outcome for all of them. That's all from me. Thank you very much.
Would you like to comment, Dr. Koukougianni?
I don't know if somebody has a question.
I just wanted to say, first of all, thank you to Maria, because she shared a lot of information in patients' organization about this innovative therapy, and we are in close collaboration and communication from now on to facilitate the patient pathway to this treatment. And we also have to admit that the inequalities that the patient community face are very important, and we have to start thinking about what we can do. For me personally, I was very happy when I saw the program that Papageorgiou Hospital follow for the hadron therapy, and when they have the trainer session, this was, Maria, a very big success, and we should do the same.
Thank you very much. So let's thank the speaker again. And now we move to the last talk of this.
Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.